Um, Looking forward, I mean, how practices should position themselves to prepare for these changes, I think. One thing they have to understand is that the medical system is going to be flooded with patients with sniffs, sneezes, whatever, back pain patients. I mean, you're just not going to get in which case, chiropractic can position itself as being available to provide more immediate care for patients with those problems and more efficient care, because by the time they would ever get an appointment with a medical doctor or an orthopedic guy, they're already done treatment through a chiropractor. The other thing is while you could position your practice as providing purely wellness-oriented care, acute upset, wellness, maintenance, traditional chiropractic. I think it's important to for a successful practice to tap into a number of different cash markets, whether it's nutrition, weight loss, some folks doing some very amazing and very effective and profitable treatment, with laser. You got decompression, for people with those kind of problems. And, you're not going to be successful self-limiting yourself into one dynamic. I think you need multiple profit centers looking not to hit a grand slam on any individual one of them, but you win the game by hitting base hits in all of them. As far as, we talked about access, there is one other issue, is that, if you can get pain relief without drugs, I mean, drugs are expensive. And the coverage of drugs, is questionable. Different plans cover different drugs, for different reasons. And even the drug that you may be prescribed may or may not be covered, and that leads to an enormous out-of-pocket expense. So obviously, a more holistic approach to resolution of acute onsets of pain that don't involve drugs is not only cheaper, but I think ultimately, from an access perspective, they're going to get that relief before they need the drugs. Of course, if it doesn't work, I mean, that option's always there, and you can refer into that model. But patients having an opportunity and the availability to get effective care timely, and without expensive and potentially non-covered medications, there's a marketing opportunity to tap that demographic and sell that message. That I think chiropractors need to be prepared. They need to be prepared to make that argument. And one last thing, we talked about marketing briefly. As a cash practice where you're not engaged in third-party reimbursement claims, your marketing opportunities expand greatly. Because you don't have any of the kickback, inducement-oriented marketing prohibitions when you're not billing third-party payers, because that's who those laws are designed to protect. So, I mean, if you want to give away $500 gas cards to everybody that's a new patient, go for it. You want to give away free exams, go for it. None of that stuff ever leads to a third-party claim, in which case it never implicates most of your state anti-kickback. You need to look and make sure that that form of marketing is okay with your licensure board. But once you clear that hurdle, you don't have to worry about, inducement attacks, kickback attacks, patient runners, things of that nature. All of those things become available to you, and allow you to market your practice the way chiropractic practices were traditionally marketed, because they were in a cash world.